we live in this toxic world. There have been several books about the toxic planet, and we hear about the poisons that have seemed to become a problem with the humans and also with the animals, unfortunately.
If I had to look at the major cause of problems or disease in our culture, I would say it's toxicity or congestion. It's not cancer, it's not cardiovascular disease, it's not arthritis. All of these are results of a toxic, congested body that is misusing the types of foods and the amounts of foods and the substances that we have at our discretion.
Most water is polluted, and there are inorganic pesticides, solvents, as well as heavy metals such as lead, aluminum, cadmium. And there's also chlorine and fluoride that are in tap water that are toxins and interfere with normal thyroid function.
1 out of 3 Americans have parasites and don't know it.
There are more than 100,000 xenobiotics or toxic chemicals available for use widespread now in this world. And it's hard to imagine that we can possibly understand what the effect of 100,000 different chemicals would have on the very delicate detoxification enzymes in our bodies.
Sometimes a smaller amount of a toxin will cause a greater degree of damage in one individual, where the next person is more physically robust and is able to withstand it with no visible problems.
We're a very toxic nation. In fact, we estimate that there are over 100 million Americans every day that are sick and aren't even aware that they help participate and hence could have prevented these maladies. We eat too much, we eat the wrong foods, we drink too much, we're around environmental pollutants, and a lot of this is leading to major diseases and premature aging. But we're not recognizing the syndrome known as autotoxemia. I'm Gary Null. I'd like to welcome you to a special program on detoxification, a natural approach. We're going to show you what causes toxicity, how does it manifest, what are the symptoms, why hasn't it been diagnosed properly, and all the different techniques to reversing it from your system. Join me now. I think you'll find it enlightening.
Most people think of toxicity as something that happens only when they're having a hangover or have experienced the acute results of some sort of disease process where they're just plain not feeling well. Of course, the question is how well can you feel to begin with, but apart from that, all of us deal every day with a burden of toxins that come from the environment and from our own chemistry. Getting rid of these in our bodies is a terribly expensive process. It is as expensive as growing is for children. It's an enormous task that our bodies undertake every day. So taken from that standpoint, just as feeding a child well and making sure they stay away from things that are not good for them is important for children to grow, feeding yourself well and staying away from things that aren't good for you is important for grown-ups and children to carry on this very expensive process of getting rid of unwanted things from the body.
I consider the process, the both medical and health process of detoxification, to be really one of the more important therapies as we come into the 21st century. So many problems in our culture are related to toxicity, or having substances come into our body through our food, through water, through the air that we breathe, that our body has difficulty processing.
Detoxification is a multi-level approach, multifaceted, that gets these toxins out of the body through the major excretory organs and through diet and through other methods.
If I tell people I'm detoxing, they think I'm just withdrawing from alcohol or drugs. So I have to, I guess, specify to a lot of people that this is a whole detox, that you're cleansing your whole body and taking things further than just if you are withdrawing from alcohol and drugs.
Francis Taylor is one of America's leading authorities on how we end up becoming toxic
and how we can remove these toxins from our system.
In thinking of detoxification, we have to consider what is a toxin. If you look up a toxin in a dictionary, it'll say that a toxin is a protein or conjugated protein made by plants, animals, and some bacteria, which are harmful to the human body. We like to consider anything that is harmful to the body as being a toxin, not necessarily just a protein. And if you consider this broader definition of a toxin, there are many things which can be considered toxins. For example, food can be a toxin, water can be a toxin, air, noise pollution can be a toxin. Of course, the thing that most people think of when you think about a toxin is the chemicals that we encounter. And chemicals which are found in the body that are foreign to the body are called xenobiotics. And those are perhaps the most common toxin that we deal with when we're dealing with detoxification.
Toxicity is not being able to get rid of unwanted things that your body should get rid of. And that includes, of course, the things that we all understand to be toxic coming from the environment, various poisons in our food, water, and air. But of course, it also includes things that are generated in our own body. These are substances that come from our own chemistry, which make up actually a fairly heavy burden of toxic materials that we generate every day. Plus, our own intestinal tract generates a very substantial amount of toxins. So not being able to get rid of these things is by definition, results in a state of toxicity or too many toxins in the body.
When we're active, when our body is going through stress, internally, biochemically, we are generating toxins that must be dealt with by our liver and other detoxification systems.
If we consider the broader definition that anything that's harmful to the body is a toxin, there are many things that fall into the category of being a toxin. For example, the food we eat can be a toxin. It can be toxic to us either because we're allergic to it, or it can be toxic to us because it contains preservatives, additives, artificial flavoring, artificial color. The food manufacturers cater very heavily to the American public's demand that their food be beautiful and it tastes wonderful. And many times they add chemicals to the food to achieve this, which are harmful to us.
There are pesticides, hundreds each year, that are being introduced into the environment, and pesticides poison the liver, interfere with normal liver function, and over time can accumulate in the fat tissues of the body and also make us very sick.
Let's talk about sugar a minute. Sugar is really the most common addiction in this country and probably worldwide. People often who are overusing sugar may start their day with sugary cereals, donuts, have a candy bar, have a bottle of unnatural fruit juice that probably has 8 to 10 teaspoons of high fructose corn syrup, which is the latest replacement for refined white table sugar. Or they might drink a can of soda, which often has about also 8 to 10 teaspoons of that pure white sugar that many of us have come to know so well. And they might do 3 or 4 cans of soda, they might do candy bars, they might do a variety of substances. They're getting a lot of calories and very little nutrition. That doesn't make way for a long, healthy life, in my opinion. Also, the regular use of sugar affects people's moods, causes a lot of what I believe premenstrual syndrome in women, causes a lot of problems with the digestive tract. And if we do have any problems with yeast or parasites, it tends to feed those and increase them in our body.
I tell people as much as possible to avoid foods that have labels on them. Once a food has been labelized, it really is not a very healthy thing to consume. Now, when they put a label on something, they take out all the important nutrients, and they take out the fiber, and they put back a small amount of the vitamins, add extra salt, vitamins, a lot of times chemicals, and preservatives as well.
Through the different lifestyles that we lead, our processed food, the preservatives, the additives that we add to our foods, toxicant, MSG, BHA, BHT. It's amazing, we just go on and on, all the different forms of toxins that we can create in our body.
Our water can also be toxic to us. It can be toxic to us because of things that have been put in there, either from a purification process or runoff products. For example, runoff from lawns contains fertilizers and pesticides and weed killers. You can imagine what's in water that comes from a cattle lot or water that comes from a construction site. Sometimes people even have problems with the amoebas and algae that are in water.
It's very easy to get parasites from drinking tap water, from eating at a salad bar, eating fruit that's not washed, vegetables that aren't washed, swimming in a lake, swimming in the ocean. You can contract parasites from any of these things.
Parasites have become more and more prevalent in our day and age, and it's because of the tremendous amount of communication that we have now all over the place. And what I mean by this is that people are flying all over. There's a great emergence now of international travel. Certainly there is a kind of environmental level that we've sunk to because of the various deterrents in the atmosphere, soil, and the water that make it possible for parasites to emerge into the health scene.
We know that most municipal water supplies don't filter out bacteria, viruses, parasites, pesticides, and those things are things that people ingest every day when they drink that water.
Usually what people think of when they think of a toxin is chemicals. And we're exposed to chemicals everywhere we go. We're exposed to car exhaust. We're exposed to chemicals if we clean our house. Some household cleaning supplies are very, very toxic. We're exposed to chemicals if we wear makeup, if we wear deodorant. And of course, it behooves us to select the least toxic products possible to put on our bodies. Our skin is our largest organ, and it will very rapidly absorb anything that we put on it. And wearing perfume, while it smells very pleasant to some people, it really is not a good practice because our bodies absorb all the chemicals in the perfume that we put on. We're exposed to chemicals where we work. For instance, if you have a copy room where you work, the fax machines, the copy machines put off vapors that contain harmful chemicals. Some jobs are very toxic just by the nature of the work that the person does. Many industrial jobs are a large chemical exposure to the workers there.
I don't know if people have heard this, but it's becoming more well known that there are sick building syndromes due to poor ventilation. There are a lot of chemicals that are used in paints, in furniture, and there's excessive amounts of formaldehyde, inorganic and organic solvents that we breathe in on a daily basis that also can make us very sick.
One of the things that I would really like to mention is the toxicity of heavy metals, particularly aluminum. Half of the cookware that's manufactured in the United States today is made of aluminum. Dr. Parcells knew that that was a very dangerous metal and it should not go into the body. People using aluminum cookware and using aluminum foil are running terrible health risks. Aluminum has not only been implicated in things like senile dementia, but it actually is now, people are admitting, even science is admitting, that it is dangerous to bring that into the body.
Well, if you have plumbing that still has lead solder in it, you can be getting a lead contamination. If you cook with aluminum cookware, you can be getting an aluminum contamination. If you have silver fillings in your mouth, you may be receiving toxic doses of mercury. Another toxin is electromagnetic problems. All electrical appliances, high-powered wires, all emit electromagnetic fields, and these can be very toxic to us. We first heard of electromagnetism being a problem whenever a patient walked in one day and announced that she had worn an electric watch for 4 years with no battery and it kept perfect time. And this, of course, was mind-boggling to us because we had heard of people who had electromagnetic problems, but we had never encountered one before. She went on to say that at her job at the lab, they would not let her in the computer room because the computers went crazy whenever she walked in the room. And I was telling one of our employees about this patient. She said, "Oh yeah, my computer turns on every time I walk by it." These are people who are severely affected by the electromagnetism, the electromagnetic radiations that they encounter in life.
You know, we could talk about heavy metals or other substances like organophosphates that are found in pesticides or solvents. But people don't commonly think of medications as also being neurotoxins. There are a variety of medications that are actually toxic to the nervous system. For instance, neuroleptics, which are prescribed for schizophrenia, are extremely toxic to the nervous system and produce Parkinson's-like symptoms, as well as Parkinson's disease and other types of movement disorders in which people have unusual and very profoundly disabling types of motor movements. In children, for instance, I found a high correlation of children diagnosed with autism, a direct correlation with their antibiotic exposure at a young age. Very, very commonly when you do a history of a child diagnosed with autism, the mother will tell you that he's had 25 to 30 ear infections and numerous antibiotics.
At the other end of the spectrum, we have senior citizens who are walking pharmacies, who are taking anywhere from 3 to maybe 15 medications to control a whole host of symptoms, including abnormal behavior, psychotic behavior, depression, fatigue, and this is not normal. This is not a result of medicinal deficiency of these drugs as much as it is a buildup over time of toxins in the environment, in the food that they eat, and in the water that they drink, and the air that they breathe. This is the end result, and it does not have to be treated with medications.
There is substantial evidence that taking medicines results in illness in a very large segment of people consulting physicians, so that a good deal of medical practice actually can be accounted for by the difficulties encountered as a result of taking medicines. And the take-home message as far as toxicity is concerned is that these medicines that we take have to be detoxified, and they join a stream of substances in our body that may make a very big difference in the total burden of the stream. Now take, for example, antibiotics, which in general, I think I was brought up in medicine thinking, gee, since an antibiotic is not aimed at my chemistry, but is aimed at a germ inside me, then it's okay, I can take it, it won't bother me. And many antibiotics are very well crafted to do very minimal damage to my own chemistry and just go after these bad germs. And of course, antibiotics are life-saving and very important tools that science has brought us. On the other hand, when you take an antibiotic, you kill off a substantial number of the healthy germs that live in your digestive tract. And some fairly nasty germs may move in and produce toxins that completely alter the situation as far as your toxic burden.
The concept in children with autism, for instance, is that high exposure to antibiotics leads to a state of dysbiosis. This means that there's a disruption in the ecological balance, if you will, of normal bacterial flora in the intestinal tract, as well as pathological types of flora, including bacteria known as anaerobic bacteria and yeast. These anaerobic bacteria and yeast have very, very profound metabolic activity. They release a variety of neurotoxins that are circulated into the bloodstream and have a variety of neurological symptoms.
What the intestinal flora is bacteria that's native to our colon. It's healthy, it belongs there, and what its function is to help fight off viruses and colds and flus and things like that to help keep us healthy. When there's too much fermentation going on, the flora can get out of balance. What happens is there is a bacteria in the colon called Candida. It's a normal, healthy part of our intestinal flora. What happens is, since it's yeast-like in nature, when things start to ferment, it grows and overtakes the flora, the bacteria level in our colon. And that can also cause a lot of illness and sickness and disease.
An excess of normal body chemicals can be a toxin. If you exercise a lot and get an excess of lactic acid in your muscles, this can be a toxin. If the acid-alkali balance in your body is skewed, this can be a toxin. For example, your stomach must be acidic for your protein to digest. Your small intestine must be alkaline for the digestive enzymes to work. And if this acid-base balance is off, this can cause toxic and health problems for a person.
How do we identify which toxins are in us? Of course, we can look around at our environment and see what's there to begin with. For example, last week I saw a man who had spent most of his life as an engineer working in the field of metals. Well, I wasn't too surprised to find that when his analysis of his tissues, hair and blood and urine, came back, he was loaded with lead and cadmium. Now, does that mean that because he has prostate cancer, which is not, quote, caused by lead and cadmium in the direct sense, that we shouldn't pay attention to getting rid of those poisons? So for him, just taking a good history, as is always the case for a doctor, is the place to start. What have you been exposed to? Are you an artist, therefore being exposed to chemicals? Are you a teacher, where you've probably been exposed to a moldy school, because many of the schools in the United States, at least in the Northeast, are moldy and have poor ventilation systems. Are you exposed to other things? Then there are tests on your blood, hair, and urine that will measure these things that are really quite accurate now. And it is no longer a matter of just kind of for the people with occupational exposures that these may be significant. Everybody who's chronically ill should be tested for heavy metals and some of these pesticides and other things to see, under certain circumstances, if their symptoms might be due to toxicity.
Toxicity is most easily diagnosed by the clinical state of the individual. If we have problems that we will call congestive, which again are allergies and asthma, arthritis, skin problems, constipation, indigestion, headaches, and other aches and pains, these are often problems of congestion or toxicity. There are certain tests, there are detoxification profiles done through blood and urine that some labs have begun to do in the last several years, and these may help at least at assessing how capable you are of proper detoxification. Someone who may be weak in these areas may be supported by certain nutrients or by changes in their diet.
Toxicity, environmental toxicity, has really wormed its way into our lives. Listen to some of the symptoms of environmental toxicity: headaches, backaches, runny nose, fatigue, joint pains, nervousness, skin rashes, cough, frequent colds, sleepiness, hives, irritated eyes, insomnia, nausea, sore throat, dizziness, indigestion. And you know what's interesting is we have so many products now on the market and in the shelves of drugstores to combat these various ills, and yet there should be no reason why we have these ills in the first place. We shouldn't have to go to a drugstore to take care of something that can be easily taken care of by making sure that we protect ourselves from these environmental toxins, and when they build up in us to such a degree that we can't hold them anymore, to detoxify our bodies of them in order to really stay well.
I do microscopy with my clients, which is called live blood analysis, and I'm able to actually see the different toxins within the system and what it creates to the body. It actually literally destroys the cells. Once it starts destroying the cells, it allows the vulnerability of the body to actually suppress its immune system, and eventually we'll die if we don't take care of ourselves.
The interesting thing about toxic symptoms is that actually many of us experience them on a regular basis in the form of fatigue, say, not having enough energy. As I was pointing out before, energy is something that you need a lot of to get rid of toxins. It's a very expensive synthetic process in which molecules that are not good for you have to be joined up with carrier molecules to get them out of your body. This synthesis is something that requires a lot of energy on the body's part, and when it isn't working well, it robs you of energy in the more metaphorical sense, and you just don't feel well. Many people go to their doctors complaining of fatigue or various symptoms of malaise or feeling out of sorts or depressed, and the doctor does the tests, you know, the blood count and and the chemistry screen, the doctor says, well, everything looks fine. And of course, everything looks fine from the standpoint of the absence of an identifiable codable disease, but the patient still feels poorly. And I think this is a good sign that something in their chemistry is out of balance.
The indications for radiation are numerous, and they include things like muscle aches, mild nausea, more fatigue than usual, persistent headaches, slight dizziness, the discomfort associated with airplane travel. And by the way, the jet lag, is really related in a fundamental way to this toxicity of radiation.
Another common symptom that is often misdiagnosed and not treated properly is arthritis, also muscle aches and pains. Very commonly can be due to toxicity that is not being treated. And most of the time it's treated with medications, which in the long run can make the toxicity worse and the problem worse. And instead of it being a problem that can be cured and taken care of, it becomes a chronic, ongoing problem that really never is solved or cured.
The easiest way to look at imbalance in our body is that we either become congested from too much coming in, or sometimes we're just under increased amount of stress and our body is unable to keep up with everything. It weakens our ability to eliminate. Our elimination systems include our gastrointestinal tract, our skin, our lungs, our urinary tract, and secondarily our sinuses and worsening conditions in the skin. So many problems of congestion might be skin rashes, allergies and asthma and sinus problems, arthritis, inflamed, irritated joints, high blood pressure, high cholesterol, all kinds of cardiovascular disease. Cancer is probably a problem of toxicity.
All right, toxicity can affect all systems of the body. And the symptoms of people who need detoxification can be many, many and varied. For example, people who have problems with the toxins in foods will have gastrointestinal symptoms. They may have nausea. They may have heartburn that's either intermittent or constant. And of course, a very common gastrointestinal symptom is either diarrhea or constipation. And some poor people have the honor of having alternating diarrhea and constipation, which is a very unpleasant state of affairs to have to endure. The muscular system, musculoskeletal system, can be affected by toxins. A lot of people have a lot of muscle pain. In fact, it can be acute muscle pain that makes them very, very uncomfortable. They can have joint pain, which ranges just from mild joint pain occasionally to excruciating joint pain. They can even have damage to their joints from this pain and from the toxicity. Neurological symptoms are particularly common when people need detoxification. Mental confusion is a very common one.
One of my favorite expressions to try to talk to my patients is that if you're sitting on a tack, it takes a lot of aspirin to make it feel good. Meaning the best treatment for tack sitting is tack removal. And if you add something that may, in fact, not help at all to dislodge the tack, but just numb you to the presence of the tack, you're not just taking a kind of false step, but you're adding a burden to the body that may make quite a difference to your chemistry. Most of the medicines that we take, and I'm not opposed to taking medicines, but most of them we take do add an additional burden to our capacity to detoxify.
One of America's leading health authorities for many, many years was Dr. Hazel Parcells. She had what was called the Parcells Plan for Health and Longevity. Joseph Dispenza worked for many years with Hazel Parcells on helping people understand the many ways that we become toxic and natural ways of cleansing them from our system.
7 steps of the Parcells method were developed by Dr. Hazel Parcells. Dr. Parcells was born in 1889 and she died in 1996. She lived a very full and rich life to 106, and much of her longevity she attributed to her method, which she developed over about 65 years. The first step of the 7 steps of the Parcells method is detoxification. Dr. Parcells felt that it was very, very important to put new wine into new wineskins and not old wineskins, meaning that if we put good, nutritious, clean food into bodies that are prepared by a very thorough detox, that we were going to get much more nutritional benefit from that, and it would be very health-giving, in fact. So detoxification, the cornerstone of the Parcells method.
The symptoms of a toxic brain can be very, very expansive. Brain toxicity or neurotoxicity can manifest itself in a variety of ways. People can have irritation of their peripheral nervous system, which would give symptoms like neuropathy, numbness in their hands, difficulty walking, and difficulty with their balance. Conversely, the central nervous system is also vulnerable to toxins from the environment, and these can cause problems such as confusion, behavioral difficulties, dementia, spinal cord problems. So really any area of the nervous system is vulnerable to various types of environmental toxins.
These two systems, the central nervous system and the immune system, whose joint activity is perceiving the world around us and remembering it, and then responding to it by a process we call recognition, that these two places, these two activities of the body are the home of permanent cells. And we want to take good care of these cells. It's almost as if they're the queen bee in the hive and all the other worker bees. If we remember that we are the owners of these permanent cells, which are in many ways the repository of our enduring self, then we may take a little bit more serious approach toward protecting them from accumulating toxins that will impair the health of these permanent cells. To me, this notion that there are within us these two populations of permanent cells is one of the most important facts that I've learned as a doctor and guides me especially in thinking about this business of detoxification, that getting rid of things in our body is not just so that our skin stays looking nice. We can get new skin tomorrow, so to speak, in terms of the replacement of cells that come with the healing of a rash or a small scar from a trauma. But we cannot get new cells in our central nervous system and in our immune system.
The brain is a particularly vulnerable organ to toxins. The reason why the brain is particularly vulnerable to toxins are for several reasons. One is that a small area of damage to the brain could produce very, very profound effects. This is in contrast to other organ systems like the liver, for instance, or other organ systems in which if you lose a small area of that organ system, you may not necessarily see clinical problems. But in the brain, even a small area of brain damage could produce very, very profound neurological problems. The second reason why the brain is particularly vulnerable to environmental toxins is because it lacks the reparative processes that you normally find in other cells of the body. The third reason that the brain is particularly vulnerable to toxins is because there's a highly advanced communication network that the brain uses. This is a very, very intricate system that basically the world's most powerful and sophisticated computer pales in comparison to the ability of the brain to process and communicate information. Well, you can imagine that if you interrupt this elaborate circuitry that exists in the brain, you can really have catastrophic and devastating clinical manifestations.
When people are reacting to chemicals, all parts of the immune system are being affected. Once an allergic reaction starts, there's an immune cascade that takes place. Histamine and serotonin are released from the mast cells in the body, and these cause inflammatory symptoms and unpleasant symptoms. Other chemicals that are released affect the brain, and this is where the brain fag or the brain fatigue comes in that makes it difficult for people to think. Most of the time when people have brain symptoms where they're either confused or they don't have memory, they're reacting to a chemical.
One of the interesting relationships of brain diseases is its relationship to the immune system. The immune system functions as a highly sophisticated alarm system or security system for the rest of the body, including the brain. The immune system utilizes a variety of substances, including cytokines, which are these messenger molecules that communicate with other parts of the body to mobilize immune cells. Well, we know that these cytokines are neurologically active. There are receptors on brain cells that actually respond to these immune signaling devices. This is a beneficial effect, but there's also a double-edged sword. The reason why it's a double-edged sword is because when the immune system actually goes on an offensive, for instance, if a person is exposed to a virus or has head trauma or is exposed to a variety of neurotoxins, this mobilizes the immune system. When the immune system is mobilized, a variety of things happen, including the migration of certain types of white blood cells that are highly toxic to the foreign invader. For instance, if a person is exposed to a bacteria or a virus, the immune system sends out pellets of poison which actually neutralize the invader. Unfortunately, that this also makes the brain particularly vulnerable to the immune system as well. It's sort of like an innocent bystander. The immune system goes on the offensive against what's a perceived threat to itself, but in the process of this elaborates certain types of chemicals, including free radicals, that are actually very, very damaging to a person's own nervous system.
Fatigue of all types, probably one of the most common symptoms that people come to a doctor's office for. And many times everything will be normal on blood tests and exam, and eventually they're told that it's psychiatric. And yet fatigue, especially including brain fatigue, inability to concentrate, to focus, to stay on task, can be a sign of toxicity.
Memory problems are a common neurological type symptom. People may have no short-term memory at all. They may have some long-term memory of things that happened back before they got sick, but they'll have virtually no short-term memory. This is one of the problems in treating these people is you have to be very, very careful that you give very, very explicit instructions when they're in the office, and then you have to be careful to send them home with written instructions, because many times when they get home, they'll remember that you talked to them, but they will not remember anything you said. And so it's very important for them to have written instructions to which they can refer later.
The two extremes of vulnerability for people exposed to brain toxins are at an early age, infants and children, and people at the other extreme, the elderly. The reason for this is as follows. Children are very vulnerable to brain toxicity because the nervous system is going through a high rate of development and growth at that period of time. Conversely, old people are also vulnerable to brain toxicity because of the fact that they have lost their ability of a concept called plasticity, which means that the brain is able to repair itself.
Dr. David Perlmutter is a physician who uses nutritional approaches for brain and neurological toxicity, and also to help people with Parkinson's, ALS, and multiple sclerosis, using detoxification as a primary modality in treating people.
So what we're finding is that certain individuals, because of a genetic predisposition, are unable to handle exposure to certain toxic substances in the environment, like pesticides and herbicides, and other types of toxic things that are being produced at the rate of 3 new substances every day. So while most people can handle toxic substances of one form or another, certain people, by virtue of a genetic flaw in their liver detoxification systems, are unable to handle these toxic exposures. What happens then is, when they are exposed to certain toxic things in their environment, these toxic elements accumulate in their bodies and cause degenerative changes or destruction in the nervous system, leading to such things as Parkinson's disease and Lou Gehrig's disease, or ALS. Now let's take, for example, Parkinson's disease. Our published research has demonstrated that in the younger population with Parkinson's disease, and we mean typically 55 years or younger, very frequently these individuals are suffering from a very easily demonstrated enzyme detoxification flaw. Now this is sort of a unique perspective in that here we have a brain disorder which typically is evaluated and treated by brain specialists, but in actuality what we are finding is the primary disorder resides in the liver, or the main detoxification organ of the body. Now we've done liver detoxification studies on many of these younger patients and found that in fact most of them demonstrate significant flaws in the way that their liver is able to detoxify chemicals to which they are exposed.
I think that unfortunately most physicians don't have a high index of suspicion in the relationship of exposure to environmental toxins and neurological problems. There is a lot of ongoing research that has not reached the clinician's hands looking at studies correlating, for instance, heavy metal toxicity with multiple sclerosis or with Lou Gehrig's disease. There's a lot of epidemiological studies with, for instance, cadmium and ALS. So I think that it's not difficult for a clinician to miss these things if they're not thinking about them when a patient presents with a variety of unusual neurological symptoms. It's easier to either pigeonhole them into a particular disease classification or to basically dismiss the patient as having psychological problems.
Now the exciting thing about recognizing and understanding this whole concept, this whole mechanism, is that in fact there are now therapeutic techniques which can upregulate or turn back on the liver detoxification systems in these people. A technique developed by Dr. Jeff Bland, as a matter of fact, is designed to actually turn back on certain flawed enzyme systems, allowing these individuals to appropriately detoxify those chemicals to which they are exposed. We have had dramatic results in patients with Parkinson's disease, for example, certain of them who do demonstrate significant detoxification flaws when we place them on a certain program that allows their liver enzymes to become much more functional. They have significant clinical improvement, their requirement for medication goes down dramatically, and overall they feel better. But what's most important is the fact that their disease process slows down. Their rate of degeneration slows down, and this is certainly a major step forward. We're finding similar enzyme flaws in patients with Lou Gehrig's disease, and it's probable that with research we're going to find similar enzyme problems with detoxification in most neurodegenerative diseases. We undertook a study of treating these patients with a very specific nutritional program designed to increase the efficiency of their liver detoxification activity. And what we have found is that many of these patients have a profound improvement in their Parkinson's disease. The videotape that we're going to demonstrate now shows a patient, a 38-year-old physical therapist, who for the past 2 years has been demonstrating progressively worsening symptoms of Parkinson's disease. Now, as a child, he had a significant exposure to toxic elements. He and his friends used to follow the tractor that sprayed chemicals on the agricultural fields right across the street from where he lived. They would do this for fun, and he recalls quite vividly smelling and inhaling the chemicals that they were spraying on the crops. 2 years ago, or 2 years prior to the onset of his problem, he remembers that he began feeling quite sluggish, and indeed that marks the beginning of his symptomatology with respect to Parkinson's disease. Now, at the beginning of the videotape, you'll see him before treatment, and at this point he is on a fairly high dosage of the typical medications used for Parkinson's. If you pay attention to the date in the lower right-hand corner of the video, you'll notice that we'll demonstrate this patient some 2 weeks later, and you'll see that in fact he has a profound improvement of tremor and also the fluidity of his movement. the way that his arms move when he walks, and the ability of the patient to smile. And indeed, if you'll notice, even his blinking rate is faster. But pay particular attention to the before and after experience with respect to the tremor of his hands. Now, mind you, this is not an achievement made by giving him more medication. In fact, during that 2-week period of time, his medication was cut down dramatically. The only other therapeutic intervention that took place was increasing the efficiency of his liver function, of his liver detoxification ability, by putting him on a specific nutritional program designed to turn on his liver enzymes. It is known that the mechanism by which these toxic elements destroy brain tissue is by enhancing free radical oxidation, thus increasing the antioxidant potential of the patient is also very critically important. That's why we use substances like high-dosage vitamin E, vitamin C, the trace element selenium, and alpha-lipoic acid in a dosage of approximately 500 milligrams each day. An herbal substance has been found to be dramatically helpful in enhancing the way the liver detoxifies. And that herb is called silymarin, or milk thistle, and that makes up a very important part of our liver upregulation program. Now, the program that I've described here for this patient and our other younger patients with Parkinson's disease is very similar to that which we use for a variety of neurodegenerative diseases, like Lou Gehrig's disease, amyotrophic lateral sclerosis. For what we find in Lou Gehrig's disease is quite similar. These patients demonstrate a significant increase in incidence of exposure to toxic elements in the environment, and clearly their problem, the mechanism of their problem, deals with enhanced free radical oxidation of the brain. So our goal is to limit the effect that these toxics have on the body by increasing liver detoxification activity and increasing their antioxidant potential by using things like L-glutathione, high-dosage vitamin E, vitamin C, the trace element selenium, which is important for glutathione production, and a very important brain antioxidant, which is alpha-lipoic acid, in a dosage of from 500 to 1,000 milligrams each day.
Acetyl L-carnitine actually is being studied for a therapeutic role in Alzheimer's disease. It has a variety of interesting effects. One of its effects is it's an antioxidant, again at the level of the mitochondria. It also increases the ability of the mitochondria to utilize beneficial substances, including fats, so the mitochondria could function more adequately. Another interesting substance which has been used and looked at in relationship to neurological problems is selenium. Selenium has the ability to increase superoxide dismutase. Superoxide dismutase, like glutathione, are two of the most important intracellular antioxidant systems that protect our cells, including our brain cells, from oxidative injury.
So what we find to be dramatically helpful in these patients, giving them a much better feeling of well-being, increasing their energy and their cognitive performance, is to approach that problem of mitochondrial deficiency or energy utilization deficiency using substances like coenzyme Q10, for example, in dosages of approximately 200 milligrams each day. We find that these patients, when treated with a comprehensive nutritional approach, feel better. Brain performance enhances. Cognitive performance enhances. Level of disability goes down dramatically, and perhaps what is most rewarding and most striking is the fact that their medication requirements often go down dramatically as well. We see increased cognitive performance, for example, in patients with Alzheimer's disease, given various nutritional supplements which are so widely and commonly used in Europe, for example, and in the East for enhancing cognitive performance. Things like ginkgo biloba, L-acetylcarnitine, phosphatidylserine, high-dosage vitamin E. In other countries, these are used readily and are known to enhance cognitive performance. These nutritional supplements play a very dramatic role in enhancing the well-being and indeed the cognitive performance of Alzheimer's patients. So overall, nutritional concepts, nutritional approaches have a dramatic effect in a variety of neurodegenerative diseases. The results that we are seeing are extremely important and extremely dramatic, and should certainly be, this information should certainly spread to other physicians, even those practicing mainstream neurology.
Ginkgo biloba is another example of a substance. It's actually a Chinese herb. It's one of the oldest Chinese herbs recorded in literature across the world, and it has a variety of beneficial effects in brain wellness, and also a variety of beneficial effects for brain neurological problems. Ginkgo biloba has several properties. One, it prevents clumping of platelets. We know that a large array of neurological problems may also be due to lack of cerebral blood flow to certain areas of the brain. As we age, our blood vessels become less pliable. We lose circulation to our brain, and this lack of circulation to the brain actually produces a inability to deliver appropriate antioxidants and other nutrients to cells. What ginkgo biloba does is actually increases the flow of blood to the microvascular system, small blood vessels that permeate deep areas of the brain.
We need to develop programs and get the word out that the way to slow the progression of these diseases is to enhance antioxidant activity. Things like vitamin E and alpha-lipoic acid and precursors of L-glutathione are critically important in reducing the rate of progression of these diseases. Essential fatty acid supplementation has found a very important role in diseases like multiple sclerosis, which are primarily autoimmune, or diseases characterized by enhanced activity of the immune system. What happens in multiple sclerosis specifically is the immune system is simply carried away and acts over-efficiently, overactivity of the immune system, causing the immune cells to actually destroy certain brain parts. That can be controlled with essential fatty acid supplementation. Now that involves using supplements like fish oil, or primrose oil, borage seed oil, and flaxseed oil, higher than typical dosages of vitamin C and B complex with trace minerals. These activities form in the body, these chemicals form in the body, certain chemicals which are designed, or rather which nature provides to calm down the immune system and regulate it. Now the typical approach to controlling the immune system in a disease like multiple sclerosis is to administer very powerful medicines which actually turn off the entire immune system. Things much like chemotherapy, things like steroids, which we know have profound side effects and therefore downsides. A nutritional approach to a disease like multiple sclerosis provides nutrients which are healthful for the body, things which calm the immune system in a very natural and balancing way, as opposed to turning off the entire immune system in a very unnatural way, which is fraught with significant side effects.
Many neurological diseases, including neurodegenerative diseases such as Alzheimer's, Parkinson's, Lou Gehrig's disease, and multiple sclerosis, have many medical studies which have shown that free radicals are really the final common pathway of producing brain damage. These free radicals interrupt the cellular machinery of brain cells. A particularly vulnerable area of brain cells to free radical injury is an area of cells called the mitochondria. Mitochondria are an intracellular system which is involved for the manufacture of energy for all cells of the body. The brain particularly depends upon these mitochondria because the brain is such a highly metabolically active substance. Unfortunately, free radicals have a very profound and devastating effect on the mitochondria. What happens is that a free radical is able to damage the lipid layer that surrounds the mitochondria and interrupt its ability to perform its energy manufacturing process adequately. There are numerous examples in the medical literature that are correlating diseases such as Parkinson's disease, in which we know that there is a high degree of free radical damage to the area of the brain that actually produces a brain chemical called dopamine, which is deficient in Parkinson's disease.
I think it's very important to recognize that a holistic perspective is very advantageous when dealing with patients who have these brain neurodegenerative diseases, because clearly these patients are not simply suffering from brain problems. They have psychosocial problems, they typically have nutritional deficiencies, but more so, biochemically, we find that these patients have systemic disease. For example, in Parkinson's disease, we note that patients have mitochondrial abnormalities. The mitochondria are the small elements within every cell of their bodies whose job it is to utilize energy. Now, so frequently we see patients with Parkinson's disease and they complain of being fatigued, not being able to get around the house, not being able to carry out their purposeful activities of daily living. The typical response is to make a medication adjustment or to add another medication. But in actuality, the science tells us that these patients are suffering from a systemic or total body problem dealing with energy utilization. Now, this is a common experience in a variety of other neurodegenerative problems as well, like Alzheimer's disease and ALS and multiple sclerosis.
Fortunately, for every problem that we encounter in nature, nature has provided a solution for. And we mentioned earlier in the program that a variety of neurological problems are linked to deficiencies in their antioxidant capacity. Well, there are a variety of antioxidants that have been shown to be effective to prevent the progression of neurological diseases. These antioxidants have a unique feature. They are what's called lipid-soluble antioxidants. This means that they're able to cross the blood-brain barrier, enter into the brain, and perform their functions adequately. Let me give you a list of some of the antioxidants that are important therapeutically if a person were to have a neurological disease or if they're interested in preserving their brain because of a preventative type of therapy as well. One of the most interesting substances that's being studied in its relationship to neurological problems and preventing or actually inhibiting the progression of a neurological problem is a substance called lipoic acid. Lipoic acid is an antioxidant. It has an interesting feature. One of the most highly potent antioxidants, one of the most highly potent oxidants, pro-oxidants in the nervous system is a substance called nitric oxide. Nitric oxide is elaborated by the immune system when the immune system is stimulated by a perceived danger or threat. Lipoic acid has the ability to neutralize nitric oxide and therefore is believed to play a very, very important role in neurological diseases such as Parkinson's disease, Alzheimer's, and Lou Gehrig's disease. Other antioxidants that are important in neurological problems include N-acetylcysteine. N-acetylcysteine is a modification of the amino acid cysteine, which is important in brain detoxification. One of the things that N-acetylcysteine does that's very, very important is it actually increases the intracellular levels of glutathione. As we mentioned before, glutathione is one of the antioxidants that's found within the mitochondria as well as within areas of brain cells to neutralize these pro-oxidants or these inflammatory oxidative substances.